one of the questions that we commonly face these days, and I think even we had this question a few years ago, right? That genomics or genetics is basically for hereditary disorders. Like that's what we knew. But is it really ready for what we do in internal medicine, which is lifestyle disorders? Is it ready for it yet? Now, there is a difference between the hereditary disorders that we see in little kids, pediatrics age group, or maybe say in the gynecology field. The difference is those diseases are specifically caused by one particular mutation, right? We already know that, the single gene mutations. So even when genomics was really evolving, it was able to add value to those fields, like, hey, this is what we figured out, you got your answer. It became more difficult in the lifestyle disorders because it's not just the genomic analysis which impacts the disease. There are a lot of other factors which need to be taken into account, and that's why the lifestyle disorders are also called common complex disorders. One part of it is genomic analysis. You cannot just take genomic analysis on its face and say, hey, we found such and such, so you're going to be likely having this disease. It doesn't work that way. So that's one part. Then the individual's current medical profile, that also impacts. Maybe the person has a mutation for cancer, but maybe their family never expressed it. So the chances that this individual will express it is also extremely low. Similarly, the diet and lifestyle, that plays a very major role. The environmental factors, those are the factors which help in the expression of the gene. So when we treat our patients, all these things have to be taken into account. We need to make sure we give proper weightage to genomic analysis, to their medical history, to their diet and lifestyle. And the end result needs to be a culmination of all of that. Only then our predictions are going to be accurate and will add value to the patient in terms of predictive analytics, like how likely the patient is going to have the disease, or how aggressive the course is going to be, or which medications the patient should be taking.
Yes, absolutely true. Because of this polygenetic nature of these diseases, so most of us are heard about these polygenic risk scores and everything. What does this polygenic risk score exactly mean? So because there is a huge data collected across the globe, what they did is they made sure that they listed out all the genes and all the mutations associated with one disease, say for diabetes. They listed all these genes, and depending on how many people carry this mutation, they gave a scoring system. But when we started our company and started to use this one, we found there are certain redundancies in the system because of the representation of the population. So these polygenic risk scores, which are available across, are pertinent to Caucasian population. For us, we do not have that kind of a data because the epigenetic factors, which means the environment here is different, the food we eat is different. How do we take that into account when we are giving the scoring system? That is when me and Dr. Hima brainstormed with our scientific team, and then that is when we started, okay, we need to have a separate scoring system. We need to have a clinical scoring system. We need to have an extensive phenotype data, what they eat, what is the age, what is the weight, what is the regular food habits, when did they have their growth spurt, all these minute details, and then we give a scoring system to that one. And then the genes which are associated, because they have the same genes, but each and every gene, we see some genes which are common in Indian population compared to Caucasian. So we give a scoring system for genes as well. So this is called genomic scoring system, and one is called clinical scoring system. We add these two to come up with unified system. That is why the analytics, so the sequencing of gene is not in rocket science, but analyzing this in the context of how we can utilize this to the particular patient. This is when we need a lot of expertise, and this is when we need more data, and this is when our expertise will come into play, being physicians and experts in genomics. So this scoring system is something that we developed over the last 3 years with excellent scientific team, and our inputs here. So it is getting robust. The more data we add, the more the AML algorithms that we put into the system, it will become more robust. So right now we are confident that even every single patient that we take into, we know a cross section of their lifestyle, and we know what the genes are saying. Once we combine these two, the predictive algorithm will be very meaningful, and we are sure that the physician, once they look at this data, he can provide a meaningful management plan for the patients.